Hey guys, Dr. Angela with Surgical Arts and IBI Healthcare Institute, and we're just going to go over some procedures in this videos. So, question of today was difference about different thigh lifts. I've made videos about it before. I'll do it again. Classic thigh lift, there's several incisions. There's really not one procedure. It's just based on your anatomy and how much of skin you have and what's the purpose of the procedure. If we have a person who lost a lot of weight and have a lot of excess skin, usually it's the incision that has to go all the way from the knee up towards the groin. It may vary a little bit, again, based on how you carry your skin and your weight. In some people, it has to go below the knee to the calf if they carried a lot of weight in their calf previously. In some people, it has to go further into the groin, that curve into the groin, and sometimes it goes shorter into that area. So again, that will vary based on different patients and different anatomy. So that's a classic median thigh lift or skin reduction, really. Now, how it's done. So some people will just cut out the fat and skin all at the same time, kind of like a piece of cake, like cutting out a whole chunk of skin and fat and then put it together. The problem with that fat does not heal very well. So even if we can stitch it, a lot of times it does not fully heal, and it can cause seromas, which are fluid collections. And of course, a lot of those doctors will also leave drains behind. That adds to your downtime. The second method that I actually prefer to use in my practice called avulsion technique. So avulsion technique will require me first to do liposuction, pretty aggressive liposuction, especially in the area where the skin is going to get removed. And then it will also allow me to remove the skin without really compromising a lot of blood flow or lymphatic channels. That will minimize the amount of swelling you have and also minimize amount of seromas you will have. I typically will not leave the drain behind, and there's much easier recovery time and healing time with that procedure. So here I will show you the video of the actual thigh lift skin removal. So it does look a little gross if you're not into surgery. So a warning, but you can see how skin basically comes off. That's the avulsion, right? Avulsion, when something kind of gets ripped off of another structure. And we do it on purpose in a controlled fashion. Obviously, I use some other dissecting techniques at the same time, but that gives you an idea. And again, the reason for that is to minimize seromas, to not compromise blood flow and lymphatic channel flow, and also minimize recovery time.